Started. It's just a little bit after 7. Good evening, everyone, and welcome to tonight's webinar. My name is Julie Vecchione, and I'm the Vice President of Communications at the Medical Society of the State of New York, or MSSNY, as we call ourselves. For those of you who may not know, MSSNY is the only professional association representing all physicians in New York State. We provide access to practical resources and a strong community of professional peers. By being the voice of physicians in New York, we promote quality, accessible, and affordable physician-led healthcare. We help you connect, engage, influence, and learn. If you are not already a member, I strongly encourage you to join at MSSNY.org. Now for tonight's presentation entitled Media Training for Physicians. We are so fortunate to have with us Dr. Purvi Parikh, who will teach us how to participate in a medical media interview, from preparation to how to answer press questions succinctly. Dr. Parikh is an allergist and immunologist at Allergy and Asthma Associates of Murray Hill in New York City, and is currently on faculty as clinical assistant professor in both the departments of medicine and pediatrics at New York University School of Medicine. Dr. Parikh has published articles in allergy, asthma, in various peer-reviewed journals and textbooks, and is a national media spokesperson for the Allergy and Asthma Network. She frequently makes appearances on CBS, NBC, Fox, CNN, CNBC, and contributes to print publications as a medical expert. She has conducted media training for the American College of Allergy, Asthma, and Immunology, and has a weekly Health Watch segment on Fox 5 News, New York. So let's get to it. Take it away, Dr. Parikh.
Okay, thank you so much for having me, and thank you everybody for joining. You know, I'm sure all of you have had a long day of taking care of patients. Just want to echo one thing that Julie had mentioned. The MSSNY membership is well worth it for those of you who aren't. Our practice recently had some issues with United Healthcare and reimbursement, and MSSNY really did help out, and amongst many other things they do, and including advocate for us in New York State. So that's just my pitch, and that's from the heart and genuine. Anyway, so moving on to how to give a medical media interview. This is a really important topic, especially now as we're coming, some 3 years into the pandemic, kind of moving onto a new normal. Because as you know, there also was a pandemic of misinformation, and people were kind of starving for good, reliable sources. And the important thing is that we are the experts. We are the ones who should be, we have these conversations every day with our patients in the exam room, and this is the information that we need to be putting out there, and it should be coming from a physician. I've seen, other non-physicians interviewed, and they just don't have the expertise, right? And so we really need to be the face of medicine. Everybody is trying to be the face of medicine right now, and I think we need to take that ownership back, and rightfully so. We're trained and experienced in this, and this seems a lot more intimidating than it actually is. I gave an interview today, and basically even the reporter said, explain it as if you were explaining it to a 5-year-old. And that's really how simple it is. And we truly are the experts on all of this. So I was going to kind of go through some tips, and then I wanted to make it a little bit interactive if anybody wants to practice, just so you can see, one, just feel comfortable doing it, right? And also see how simple it is, and the types of questions that you will get asked. Like I said, it's extremely basic, and most of the things, there's no intimidation behind it. Okay, so let's take it away from there. Next slide. So you have been called upon to do an interview, and often these requests come like very last minute. They may come, out of the blue. If you work for a major medical center, you might get contacted from their media department, or sometimes they'll even cold call local allergy offices if they're looking for an allergy segment, GI offices if they're looking for a GI professional, and now a lot of experts are being found online, and I'll touch on that as well, like through social media. So first and foremost, don't overthink it, just say yes. The media, especially the reporters, they keep coming back to those individuals who are available in a pinch for them, because a lot of these stories are breaking news. A lot of it is last minute, and they, of course, within reason, want you to be available, right, kind of when they need you. Sometimes it's nice, you do have a few days advance notice, but sometimes you don't. Sometimes it could be an hour notice or 2 hours notice. So if you're able to, and obviously if it doesn't affect patient care negatively, try to say yes when you can, because then they won't come back to you if you're like, oh, well, I'm not ready right now. Come back to me later. They'll find somebody else. And then don't be intimidated or scared. I know this is a big thing that I've heard from other physicians. Like, I don't know if if I'm the right person for this. You are, just that MD or DO behind your name automatically makes you the right person for this. There are many imposters willing to step up and claim they're experts with far less training and education than you all have. So don't be intimidated or scared. You're the expert. Again, the questions are very simple and straightforward. And again, as I mentioned, physicians should be the face of medicine. And it's okay to ask for talking points or potential questions ahead of time. Sometimes they will blindside you, but that's very rare. Most of these media interviews and reporters are not adversarial at all. They're not trying to trip you or trap you or anything like that. It's very straightforward, but you can ask for these things ahead of time. Especially if you have, more than a day or a week or so to plan. And it's also okay to ask for a study or article ahead of time, because a lot of these news stories will be about something that's current or up to date. So new guidelines that got published or a new study that came out about a new drug. So it's always good to ask like what they're referring to. So that way you're not thrown off if they ask a question. And you can also ask what the questions are ahead of time and the talking points. Now, not all interviews will be like on camera interviews, like on TV. Some will be by radio. Many are print interviews, right? Where it'll either be a phone conversation. If you don't feel comfortable having a phone conversation, you can always ask also for the questions by email, and you can send your responses by email. I've started doing that so that way I can make sure everything I want to be said is said, because even in a phone conversation with the best intentions, if the reporter mishears you or, there can be miscommunication, but when it's written out, it's a lot clearer. And in that way, if you are misquoted, you have a paper trail. The other nice thing about email is that it saves a lot of time. So initially, when I was doing a lot of these interviews, I would do the phone interviews for, written articles and newspaper, magazine, or what have you, but they're very time consuming. So it sometimes can take 20, 30 minutes. And of course, if you're a busy physician, you don't have time for that. So the other nice thing about the email is that you can kind of do it at your own leisure, and it's usually a lot faster than how a phone call would be. And then the other thing too is this way you can also have time to think and process your thoughts and put them into writing. And next slide. So you have to look the part, right? It's easy for a phone interview. You can do it, in your pajamas or even a radio interview, because now with COVID, a lot of things are calling in, right? Or they're Zoom. But, there may be that instance where you have to do a TV or on camera interview. So of course, appearance should not matter, but let's be honest, in this day and age, it does. So you have to look the part, so dress the part, look professional and put together. I mean, most physicians already do this on a daily basis. So I know it seems like common sense, but you always want to put your best foot forward, because things up on you when you have the whole visual picture can be very distracting. So nothing fancy is needed. They actually love the white coat. So even if you get a last minute request and you don't like what you're wearing, it's very easy. Just throw a white coat over it and you will look great, and if you're at work, it's very easy to do that. Otherwise, anything professional clothing wise is appropriate. And then stick to solid colors and avoid any crazy prints or design or pattern, because they may be distracting. So even though, you might be wearing this wonderful floral shirt or zebra print shirt or skirt or what have you, but if the viewer is focused on that, then your message is getting lost. So again, it doesn't have to be anything fancy, but just look neat, clean, professional. That's it. Lighting is also very important. So in an in-person TV interview, you don't have to worry about that because they come, even when sometimes they'll come to the office because they like filming in a clinical setting or the hospital or what have you, they bring everything with them. But now many interviews are by Zoom because of the pandemic. So you want to make sure your setup is good so that you're in a well-lit area. If you don't have a well-lit area, you can get a $10 ring light on Amazon that will go a long way and really makes a difference. Because again, these small things matter, right? If there's a shadow over your face, no one's going to pay attention to what you're saying or the importance of screening for colorectal cancer, for example. They'll be focused on like, why does that doctor look kind of funny? So it's a small things you can do and they go a long way. And background, again, choose a clean, tidy background without much clutter. If this isn't possible, if your office is also covered in papers like mine, you can use a virtual background, which has, come in handy many times. Oftentimes your institution may have virtual backgrounds. So NYU gave me a few to use. I know MSSNY has a virtual background, and there's also many you can find online that are quite nice. Some look like an office setting, some look like a library. And then headphones also go a long way for getting rid of, background noise. And it helps with sound quality. And again, you don't need anything fancy. If you have Apple AirPods or something similar brand, that's more than enough, just the one piece of advice I would give is make sure everything is charged before you do the interview, because otherwise the worst thing is all of a sudden the AirPod goes dead and then, you get caught off guard, you can't hear anything, you get flustered. But these are just simple things that if you're on camera, it matters, because you want to look, look professional, look presentable. It's very easy, but things that we might not think about. Okay, next slide. Okay, so the actual interview, this is very important, especially in this day and age. So stick to the facts, and no matter how much any reporter or anyone tries to bait you, don't get too political or go off on a tangent outside of medical facts, because it's easy to lose credibility if you go off on a tangent or appear to be pushing a political view or agenda. And sorry, did I lose the screen? Oh, okay, sorry. And, have evidence to support what you're saying. So it's okay to, let's say, criticize a public health policy and express something could be better if it harms patients, as long as you have data or evidence to support what you're saying. So for example, you can say that, I'm just giving an example, lifting a vaccine mandate or mask mandate might be a bad idea because of X, Y, and Z. So it's important to kind of stick to as much data-based things as possible. If you do have something anecdotal you want to talk about based on your own experience as a physician, that's okay too. But again, just make it very, very clear that this is anecdotal and not based on any data, because it can be very easily misconstrued. And of course, you as a physician don't want to give off an impression that something, let's say, has a study behind it, something you might do on a daily basis. So definitely make those clarifications and try not to, again, get pulled into these things. So I have a video clip here, and it actually, believe it or not, it was like the first interview that I had ever done. And this is how I got into media. So basically, Dr. Paul Ehrlich, who I work with, he is 40 years my senior. When I first started practicing, he got this interview request and he asked me he's like, you should go, you need to get your name out there. This was maybe a year into practice. And this was when the whole like Ebola outbreak was going on and Obama was president. So anyway, I was very, very nervous. It was live. I had to go to the studio. It was like for Fox Business. And luckily, thank God, Dr. Ehrlich told me right before I went on, he's like, that same advice, stick to the facts and don't get baited. And he made a joke. He's like, this is Fox. They might do that, nothing against Fox. I'm on Fox more than anything. So, but it was just funny because that's exactly what happened. And so they tried to bait me and whatnot. But anyway, because of Dr. Ehrlich's words in my head, I kept sticking to the facts. And actually, I just wanted to show an example of that, of how they might try to steer you left and right. and what you should say as much as you can. I was scared out of my mind, but it ended up working, and this is just a perfect example of how that derailment may happen. So Roseanne, can you play hopefully the clip works. And it's a little long, but we have time. It's like 3 minutes. So I don't know how to make the volume.
It looks like Roseanne's raising the volume.
Okay. And if it doesn't end up working, I can explain in a nutshell what happened. But yeah, it was so I'll just go through it so we don't have to all watch it, but it was just funny. So I thought you all would get a laugh out of it. But literally seconds before we went live, the host, Stuart Varney, goes to me. He's like, "Oh, you don't mind if I ambush you a bit?" And I was like, "What are you talking about?" I was deer in headlights. And I was like, "What?" And before I could even answer him, we were live. So what ended up happening was, like, literally minutes before I went on, Obama had appointed an Ebola czar to take care of this Ebola crisis in America. And by crisis, we had, I think, a handful of patients, but the whole point of the interview was to kind of bring attention, because it was during the winter or right before winter. So it was to bring attention to flu season and how actually flu, at least in the US, is a much bigger threat, right? Because there's millions of deaths per year. It affects children, and people weren't getting their flu shots. So that was the main point of my interview. And he immediately went for the politics. He's like, "So what do you think? Don't you think it's wrong that Obama appointed this Ebola czar, right? He has no medical background. What do you think about that?" And so I, luckily, because Dr. Ehrlich had warned me, I sidestepped that question. And I was like, well, I'm really here today on behalf of, allergy and asthma doctors and immunologists to talk about the flu vaccine and why it's so important and why it really affects my patient population, because I take care of asthmatics and children and blah, blah, blah. And then he kept trying, and he had 2 other co-hosts with him, and they kept trying to bring up, but when they saw that I would not budge from just talking about medical facts, then their tone changed, right? And then they stuck to only speaking or only asking me about medical facts. So they said, how many deaths a year are from the flu? Is the flu vaccine safe? I've never gotten the flu and I never get the vaccine. Why do I need it? So, like, very basic things that all of us answer on a daily basis. And like I said, this interview is an outlier. So it's kind of funny that it was my first one, because normally that hostility or confrontation isn't there. Like, majority of the reporters interviewing you are very nice, very friendly. They're actually very grateful. They're like, "Oh my God, thank you so much for taking so much time out of your schedule." And the questions are just very simple. And even his questions were simple once he got past the Obama bashing. But anyway, I can send the clip later to everybody if you want to see. It's just funny. So I had it more in for comic relief and an example of why you should just stick to the medical facts, and statistics too, if you know them. And you won't really be asked to do an interview on something outside of your specialty, so you will know the topic cold usually. So whatever your specialty is, that's all right. So some tips. So obviously, we all have a lot to say. Medicine is a complex topic, so it's always good to speak in sound bites rather than rambling. So the main thing is just, get to the point. Pretend that you're explaining the concept to an elementary school student, because there's a very broad range of audience, right? Who's going to be reading or listening on the radio or watching on TV. So just make it as basic as possible. And often, most people really appreciate that, and they say, "Oh, wow, I've never heard it explained that way." Avoid medical jargon and try to use everyday terms to explain what's going on. So, for example, I can explain my field the best, obviously. So when talking about asthma, which is inflammation in the lungs, you can use terms like airway, but you can even go further and say breathing tube. Right? It's when someone says, "Well, Dr. Parikh, what can you explain what asthma is?" The breathing tube gets filled with mucus or clogged up. So it feels like you're breathing out of a straw, and gas builds up that can't get out, or whatever it pertains to your field. And you can have creative ways of talking about it. Or for heart disease, you can compare your arteries to plumbing, that gets blocked by cholesterol plaques and clogged, which can be deadly if that blockage isn't relieved. So just say it in terms everybody knows, right? Everybody knows what what happens when their plumbing gets clogged or what have you. When you're speaking about the immune system, you can explain it in that it's important for keeping outside invaders from either making you sick or having other problems. So there's a lot of different ways, and just keep it as simple as possible. And what I mean by sound bites is, let's say you have like 6 sentences worth of things to say. You might want to break it up, and say the first 2 sentences, then pause, see if the reporter has a follow-up question, then the next 2. And they really like that, because sometimes when they pre-tape the interview, they might not use everything you say, but this way they can take clips of it too for their segment. Next slide. Also, in speaking in those smaller bites, even if it's on the radio or what have you, it's just easier to digest that way. I'm sure you all know that from even just talking to patients in the exam room. If you give them a list of 10 things, they're only going to absorb maybe 3 of those things. So again, breaking up those into small segments is much easier just for people to absorb in general. So this is a question I get a lot. So how can you be known as the expert? So everyone says, well, how did you get into media? So after I did that interview with Varney and Company, actually the CEO of a nonprofit called the Allergy and Asthma Network happened to see it. And she actually was, I guess, impressed by the fact that I didn't get swayed by all the political side stuff at the beginning of the interview, and actually asked if I would be interested in coming on as their official spokesperson. And again, I was shocked. I again had like my imposter syndrome kicked in. I'm like, I'm just out of training. Are you sure that you want me? I have no experience. And she's like, no, you're the expert, and you explain complicated things simply, and you're able to hold your own. So that's my point. It's not like you don't have to have a ton of experience to become the expert. But so that's kind of how it happened for me. I actually didn't go seeking the whole media thing, but then after I became their spokesperson, it kind of snowballed because then NYU got wind of that I was doing media, and then they started asking me to do things for them. And then after a while, you get to know reporters, and if they like you and they know you're reliable and accurate and can go to you, then they keep calling on you. And then, of course, during the COVID-19 pandemic, it just exploded, right? Because things were changing day to day, and they basically were relying on healthcare professionals to really help with a lot of the confusion and misinformation. But let's say, you want to be an expert, you want to be in the media, but you don't know how to get out there, right? Or connect with the media itself. So every major medical center in the country has a media department. I did not know this until NYU had reached out to me. And they constantly are looking to get their doctors into the media because it's like free marketing for their hospital. Often NYU, it's like #1 health system in New York. And they don't need this, but they even have their own PR firm because some of these big hospitals invest so much money into marketing. It's kind of ridiculous. So approach them and say, listen, I'm interested in giving media interviews. I'm in, internal medicine department. Please think of me if something comes up. And more often than not, if their like regular doctor that they always go to is unavailable, they'll come to you because, like I said, a lot of these requests are last minute. And sometimes if someone isn't available, they come to you. So that's always a great thing. Nonprofits and medical societies also have media departments. MSSNY has one, obviously, but all the national societies do, all the specialty societies do. So my American College of Allergy, Asthma, Immunology has one. American Medical Association has one. And then, like I said, I actually represent a nonprofit. It's a patient advocacy organization that, takes care of patients. So there's so many of those too, like American Heart Association, the American Cancer Society. There's one obviously for every specialty, and you know what those are for your specialty. So you can approach them and they're more than happy to get people involved because they're looking for these opinion leaders / messengers. And then again, like I said, be flexible and available. And now this is, I would say, a new thing in the last like 4 to 5 years, but social media is now how a lot of people are getting into the mainstream media, because now many journalists are scouring for experts on Instagram, on Twitter. Interestingly enough, like I got quoted in the LA Times this way and contacted by many journalists because they're looking and reading. So that's a double-edged sword. So on the same token, if you have a public facing account, be careful what you're putting out there, because anyone can see it. And once you put it out there, they can even use it in a publication. So I rant a lot about healthcare related things, but I, obviously I keep everything professional. And this one LA Times example was that there was just about how doctors were, in my opinion, I felt under prescribing Paxlovid even once it was readily available. And so one of the tweets that I had used ended up in that newspaper, and I didn't even know until that journalist tagged me. So it made me think twice. I'm like, okay, well, at least they used something that, I wanted to get out there, but be careful too about posting anything unprofessional, because that you never know where it ends up. But that's an easy way to meet journalists because they're looking everywhere. So you don't even have to go through a media department or fancy PR firm or anything like that. Next slide. All right, so a few more interview tips. They always highlight timely news. So that's why, think of COVID, RSV. Right now is colorectal cancer awareness month. So if there is a certain month where something important is being highlighted, that's where all the news stories will go. So if you're a GI doctor, this is your time to shine during the month of March. I know cardiology just had, I believe, their heart health month. So there's something like that at any given time. And even every week, there's a different disease state awareness. So those stories, people are always, the media is always looking to highlight. Patient stories, the media really like. So if you have a patient who's willing to, obviously you want their permission, but willing to go on air or be interviewed in print, this is very impactful because they want the patient's story. They like, even though I always say stick to the facts, they still want that emotional component, right? That empathy component. So it's a lot of times the media will approach and say, oh, we heard about X, Y, and Z. Do you have a patient that fits this description? And so a lot of times they'll want to do something if you have an interesting patient. And then, obviously real life examples matter. So when you're giving those tips, even if you don't have your patient next to you, you can always, obviously without giving away personal information or protected health information, you can give that story and you can give examples, because that's really moving and more powerful than us just rambling off, studies and facts and statistics. So when I can, talk about why, when I was in residency, I saw a patient die from flu, who was, a 35-year-old mother of 3, that has a big impact, and that makes people think twice than me just saying, oh, the flu vaccine saves lives, right? So kind of framing it from a patient perspective or how it's impacted patients, I think makes people engaged more, pay attention more, and it has a deeper impact. Next slide. Okay, so that is the end. So I know Dr. Mehta had wanted me to do some mock interviews, and I think that's a great idea. Does anybody want to try? Or I promise it's not anything intimidating at all. Or does anyone have questions? We don't have to do mock interviews. We just wanted to make the rest of this time interactive as well. I think there might be some questions in the chat. Oh no, okay, those aren't questions. It's the comment about that Fox Business clip, which I will send out. All right, well, Julie, was there anything else that you had wanted to add? I won't keep people if, oh, there's one.
I think you've covered everything beautifully. I mean, if anybody on the call is interested in offering your specialty expertise to us when we get media requests, I'd love to hear from you. We tend to We tend to do a lot of advocacy related interviews, and we tend to go to our president and vice president for those, but often we get specialty type requests. So if anybody's interested, please let me know. We'd love to engage with you if you're interested.
So there was two questions. So one was from Dr. Sharma, that he asked, how do you stop people from cutting and pasting your words? Words being cut and pasted into a different version. You'll be taken out of context and misconstrued. But if it gives anyone peace of mind, I think now, over the last 8 or 9 years, I've done thousands of these interviews, and only one time was something I said taken out of context. And of course, it was during the pandemic, and it had to do with masking. But even then, when they misquoted me, I was able to get that quote removed. Which was so you can there is recourse for what you can do if it's something that's that you're saying in a TV or radio format. It's pretty hard for them to take that out of context, even if they only take a small piece of it, because you're speaking, you're in complete sentences. The only time where sometimes it can be taken out of context is for the written or phone interviews, but even that, because it's basically you being quoted by a reporter. But a few things that you can ask for, and many reporters do this automatically, they'll ask you to fact check something before they publish it, which is really nice because you can make sure, because even if they don't purposely misquote you, sometimes they don't hear what you said or misunderstood something you said. So it's a nice way to be able to clarify it. The other thing is you can ask, you'd be like, can I please, review my quotes before you print them or fact check them? And I've never had anyone say no or push back on that. So yeah, it's definitely 99% of the time, not a hostile environment. Just one time it was with the UK Daily Mail. So I'm not going to do interviews with them again, but they made this quote make it seem like I was against masking or masking was dangerous, for people with asthma and COPD, which is the complete opposite of, what I think. So anyway, long story short, I was able to get that removed. So it ended up not being a big deal, but majority of the time they don't do that. And you can always ask to review things before it's published. And if it's live, you don't have to worry about edits. That's the one good thing about live interviews, even though they're a little more nerve-wracking. What you say is how it is, right? So they can't edit anything.
Dr. McIsaac has her hand raised, Dr. Parikh.
Okay, sure, go ahead.
Do you want to go ahead, Dr. McIsaac? You're muted.
Oh, I think you have to unmute her. I think all the participants are muted. Oh, that's why. Yeah. So some people are now volunteering for mock interviews. I think they couldn't speak up before because they're muted.
They're all muted.
Oh, I think she's muted again, or maybe I can't hear. Sorry.
Mute.
Okay.
Now
I can hear you. Yes.
All right, great. All right. My quick question is, have you found people accepting an interview because you have to do it really quickly, and then if we're in an employed physician environment, that the PR, HR doesn't want needs to vet the interview and give you permission. And then that time delay means it's impossible. So that's, versus someone speaking in private practice. So in New York, right, all the health systems, if you're an employed physician, you have to go through their media permission, and then the opportunity goes because it takes too long. Is there anything to?
Yeah, that is a challenge, because I know if you are, most of the employed physicians that are in these health systems, you need clearance from their medical center, unless, I don't know it all depends on your medical center and what their policy is, but some have loopholes that as long as you're not speaking on behalf of the medical center, I've seen some people get away with it that way. But unfortunately, I think I don't know a way around, and I know other doctors who've fallen into that category where they wanted to give an interview, but they couldn't because they had to get it cleared by the health system. And the health system, a lot of times they do clear it, but a lot of times they don't. if they think it's something too controversial or what have you, or especially if it makes them look negative, but
Right.
a few loopholes I've seen is that people speak on, on behalf of themselves or another like organization. I actually got scolded by NYU during the pandemic because like I'm very big into advocacy, as many of you know, and I spoke out about the NPPA independence. So I think some NPs and PAs called NYU and complained about me. But luckily, because I'm not employed by them, there wasn't much they could do except kind of like tell me not, to tone it down. But unfortunately, if you're part of the big health system, you have to like go play by their rules unless you can somehow make it, like I'm speaking on behalf of myself. You have to you have to be very clear with the reporter not to use the health system's name in any way in it, because then you can get in trouble if you don't have their clearance. But some people have gone around it that way and said, can you not put my health system's name in it? So.
Yeah. I mean, I have done one like that, but I'm an OBGYN. So pretty much everything I say, they think is controversial because it has like sex in it or miscarriage or abortion, and they have a seizure. So anyway, I just wondered if you'd seen any really bad consequences for people speaking in their own voice versus their employer's voice in order to do that. But you answered that beautifully. So, okay, thanks.
And like I said, if you can go through your health system, that's the best. I know sometimes it's timely and you can't, but then at least you're clear. And then I think some people wanted to actually try the mock interview. But who is it? I think Rajesh Kakani, Dr. Kakani, and then
I'm ready.
You're ready?
Yeah, I didn't
Okay.
prepare, no makeup for me, but I'm ready.
That's okay. You look great.
My specialty is otolaryngology, ear, nose, and throat.
Okay.
Thank you for doing this. Thank you for doing this. Thank you, Julie, and thank you, Dr. Mehta. But I'm ready to give it a try.
Okay. So I'll just throw out a few questions. So, Dr. Kakani, what can you tell us about hearing loss? We hear that it's a major problem and it can lead to further issues down the road, like cognitive problems.
Thank you for asking that question. Hearing loss is a major problem, not only in the United States, but all over the world. And it's kind of under-recognized. And most people, because the hearing goes down in both ears and goes slowly, they don't recognize that they have a hearing loss and are reluctant to get it tested.
Oh, very nice.
So I did it in a sound bite, and I'm ready for my next question.
Yeah, very good. Yeah, so I was going to say, Dr. Kakani is a very good student because, yeah, you said it very simply, which was nice. You said short, sweet sentences. So next question I would ask is, and the only feedback I would give is feedback that I've been given to me, because I do this too, is when you're on camera, if you're on the phone, it doesn't matter, obviously, but if you're on camera, try to avoid using your hands as much. And I know during this presentation, I was doing it, but I know I always have to make a constant effort to fold my hands and keep them in my lap, because I've been told as well that it can be distracting from what you're saying. In this case, it wasn't. You just did this, go down. So that wasn't that distracting, but it just reminded me to make that point because I hadn't used it in a slide, in the slides earlier. My follow-up question to that is, if I think I'm having hearing loss, Dr. Kakani, what test can be done, or how do I get treatment?
Yeah, I think you should definitely speak with your personal doctor. But if you're really concerned about hearing loss, you should seek consultation with an ear, nose, and throat specialist. The other name for our specialty is otolaryngology. We are sort of trained to do a comprehensive examination and also find simple causes as well as complex causes. So seek a consultation with an ear, nose, and throat specialist. That would be a good first step.
Okay, great. Yeah. And so he did a great job of explaining to the patient who they should see, right? There are so many imposters out there now claiming to be specialists in this or that. So he very clearly said you should see an ear, nose, and throat doctor. We're also known as otolaryngologists. There's a lot of people who aren't physicians, right, that are saying that they provide treatments that are baloney. So it's very important to give our patients that information. You can even say, I know everyone has different views on it, but depending how you feel, you can include board certified if you want or not. But it's important also to use the word physician if you can. You can even go a step further and clarify MD or DO, because now everybody is calling themselves doctor these days. Even the trainer at my gym was starting calling himself like, doctor or something. So everyone's using the word doctor. So sometimes you have to be very, very clear, and you did a great job of that. So that was excellent. So I didn't really have any feedback outside of that. You spoke very clearly, and you kept it very simple. Does anybody else want to try? But I just want to give a sense of those are the type of questions that you will get. And another possible question you'd get is, oh, I can't breathe, do I need to get sinus surgery? And then you can, and I'm sure you would explain it perfectly, explain who needs it, who doesn't need it. And it's good that you said talk to your doctor, so it's always fine to give that disclaimer too. Like, this doesn't replace actually seeing a doctor, but this is what I would recommend, or this is what the guidelines are. And then I think there was, and I think we might have time for one or two more if other people want to try. I think there was a pediatric cardiologist that was interested. I lost the name though. Is that person still on the line?
I just unmuted Dr. Lascalia.
Oh, okay.
He
Hello.
has his hand up. I don't know if he wants to do a mock interview.
Are you
there?
Can you hear me?
If you put your sound up a bit, I think. You're unmuted, but you're a little bit low.
Can you hear me?
Yes. Yeah.
Okay. Hi, Purvi. Thanks for doing this talk tonight.
Hello.
Much like you, I had some interviews. This isn't for a mock, but I wanted to ask a quick question for you. Much like you during the pandemic, I had one interview where people were trying to prove a point that was not the point I was trying to make, i.e. vaccines are bad, like you were getting masks are bad.
Right.
I'm just wondering how you handle interviewers or reporters who want to try to use your words in a way that you are not intending to be used.
Right. Well, again, I usually would say, like, for example, I had done an interview after, the news broke about the J&J vaccine causing blood clots. And, all the reporters were like, well, should we be worried about this? What's going on? Should we not take the vaccine? Should we not have our children take the vaccine? So I again, stuck with the basic facts. I said, well, if you look at it, 1 in a million people have had this blood clot. I think that was the statistic. I was like, you're more likely to be hit by lightning than get a blood clot. Or, there was a concern around allergic reactions to vaccines when they first came out. So usually I try to combat that with just facts and just reframe it in a way so they can understand that, X, Y, and this vaccine has saved this many lives. This how many people died pre-vaccine. These how many died post. But very rarely you might have someone who just has an agenda and is kind of hostile, right? And then you can always say that, the interview is done, or you could say, I don't feel comfortable speaking with you because I think you're misrepresenting me and I don't give you permission to, use my quotes or use whatever, but that very rarely happens. But I'd be curious to know, Keith, what happened in that scenario? Did they eventually back down, or did we lose him? Oh, we have to unmute him again. Let me see if I can do it.
Can you hear me now?
Oh, yeah.
Yeah, sorry. So actually, it turns out, I tried to do exactly what you said. I tried to bring it back to the points that I thought were important, but he really wasn't having it. And I had to end the interview and just say, I'm really sorry. I understand what you're looking for, but that's not my perspective and I can't help you. And I ended the interview.
Good. No, I think that's appropriate. And then did he end up using anything that you said down the line?
No, it was one of these very far right stations that actually Misny set me up with. He interviewed me for something else where he was more reasonable. And then the second interview, he really wanted to come down against vaccines. And I just, as I said to him, I said, I can't I can't support that perspective at this point. The evidence doesn't go that way. And I didn't get argumentative. I just said, I just don't think we're going to be able to meet eye to eye here.
Right. Okay. No, I think that's perfect. I mean, that's all you can do, right? So, but I'm glad that even after you said that, he didn't. I mean, I don't think they can do that. If you say this is no longer on the record, they can't use it against you. So, but luckily, I'd say those instances are very few and far between. Most people, when you bring it back to the facts, are respectful, at least in my experience. So, luckily, that happens very rarely. But yeah, I think you handled it perfectly. So I think, is it Dr. Harnick? Did you want to do a quick interview? I know everyone's muted, so no one can speak up.
Yeah, I'm trying to find Dr. Harnick. I don't see him.
Oh, he said he can't right now.
Oh,
Okay,
there
that's
you
okay.
go.
No worries.
Okay.
And yeah, and if anyone, you know, I know no one likes being put on the spot, especially after a long day of work. But if anyone has any questions, like for me specifically, or you know, wants to run through things with me, you know, I'll let Julie share my contact information along with the funny clip of me arguing with Stuart Varney on live TV. So after this, if that helps.
Great. Okay, well, thank you so much, Dr. Parikh. I hope everybody collected some useful takeaways you can put into action. Once it's ready, we will get the link to this webinar on the MSSNY website. I will also put a link in our newsletters, The Insider and Pulse. So look for it in those publications, but we'll get it right on the website. On behalf of MSSNY, thank you, Dr. Parikh, for sharing your expertise and your time with us. And thank you to everyone else for joining us. And again, for those of you who are not members of MSSNY, I sincerely hope you'll consider it. We're here to help you navigate your career and your business, and our members are a talented and diverse community of physicians willing to share. Wishing everybody a great evening. And again, thanks so much for joining. Good night.
Thank you. Good night.
Good night.